Are you a first year nursing student and still wondering where to even start? Don't worry. Today we will break down the introduction to nursing in a very simplest way possible. So it is the basics of nursing that you should know before you even started your nursing journey to the next level. So let's get started. So welcome to the Next Gen Nursing, and I am Hel Patel. I completed my Masters of Nursing, and I am a former transplant ICU nurse. Today, we will discuss about the Introduction to Nursing Part 1. Actually, I divided the Introduction to Nursing in a Part 1, Part 2, and Part 2. So it will be easier to you to understand it in a better way. So today we'll discuss about the part one of it. So part one includes the meaning of the nursing, the definitions, what are the objectives of nursing, and what are the different types of scope of nursing practices. So stay till the end to get the better understanding of the basics of nursing. So what is the meaning of nursing? So nursing is a science and art of providing care to individuals, families, and communities to help them attain, maintain, or recover human health and quality of life. So nursing is not just only about providing care to the individuals. Nurses are also providing a care to the families and communities, also to maintain their health and providing better quality of life. Also, if patients are suffering from a particular chronic illnesses or diseases from a very long period of time, so nurse ensures this to provide better education and helps them to recover from the particular chronic diseases. So nursing is not just about giving medicines or doing procedures. It includes caring, communication, education, emotional support, and being there for the patient in difficult times. So it combines of scientific knowledge with compassionate action. So usually most of the people have that belief that nursing is just about them giving the treatment or particular medicines or injections to the patient. But it is the wrong belief, right? Nurses are more than that. Nurses are providing the care, build a trust with the patient, communicate with the patient, and communicate with the patient's family members, communicate with all healthcare workers like doctors, lab technicians, radiologists, all the healthcare workers. Then providing better education to the patients and their families, providing a psychological and emotional support to the patients, and being the there for the patient in the difficult times by 24 by 7. So, uh, if you have that belief that nursing is only just about the uh, providing a treatment or just providing with just only a particular injections or medications to the patient. So it's a wrong belief, right? Nurses are more than that because nurses are always there to support and help the patient by 24 by 7 in the hospital. So it's a combination of scientific knowledge with the compassionate sense. So what nurse word really means. So the N word represents the it's called nurtures with care. So nurses are providing a better quality care to the patients. Then you means understands patient needs. So needs, whether it is a physical need or mental need or emotional needs, right? Patients have different types of needs while they are admitting in hospitals. So nurse make sure they understand the feelings of the patient. Then R. So R means response with empathy. So nurses are understanding the feelings of the patient, right? While they are admitting or what they are going through while they are getting the treatment in a particular hospital. So nurse responds with the empathy and providing support to the patient. Then as means supports healing and safety. So nurse ensure that to prevent the patient uh, from a particular harm, like protection from infection, then providing better treatment with the follow the all right of the medications, then providing better psychological support to the patient, providing physical safety to the patient, right? So patient will not get the harm while they are admitting in the hospital. So E means educates, empowers, and encourages. So nurses providing the education to the patients and also as well as to the patient's family members, and empowers and encourages. So nurses are also encourage each other while they are working in the particular health sector. So it is a word of meaning NURX. Then what is the definition of nursing? So I wrote it down. The first definition here it is given by the Virginia Henderson. So nursing is the unique function of the nurse that is to assist the individuals aware in the performance of those activities contributing to health or its recovery or peaceful death that he would perform unaided if he had the necessary strength, will, or knowledge. So nursing is a unique function of the nurse. What is the unique function of nurse? That is to assist the individual, right? Providing the assistance to the individual, whether they are suffering from a particular disease or not, whether patient is fully healthy, right? But they have a chances to get infected from the community. Nursing is also providing education to the healthy people in the performance of those activities contributing to health or its recovery, providing a contribution to health or its recovery or to a peaceful death. Means nurse ensures that to maintaining the dignity if patient are the end stage of life. If patient are there on the bed from a very long period of time, but there is no any chances of recovery. So nurse maintain that providing the support to that family, patient's family members, and providing the dignity to that patient so that they can have a peaceful death. So that he would perform unaided if he had the necessary strength, will, or knowledge. So let's go to the second definition. So the second definition is given by International Council of Nursing. So it is nursing encompasses autonomous and collaborative care of individuals of all ages, families, groups, and communities, sick or well, and in all the settings. So nursing is encompasses both autonomous means individually, whatever nurses have their scientific knowledge, so they are independently taking the decisions of the patient's healthcare. Also, nurses are collaborating with the other healthcare professionals and also providing the better care to the individuals of all ages, right? It could be infants, then neonates, children, old age people, women, men, right? Adults. So providing the care to all age group peoples and families, group, no, communities, whether they are sick or whether they are well and in all the settings, right? It could be in the hospitals and whether it could be in the primary health care centers, sub centers, community health centers, different types of settings, nurses are providing care to the all age group people. Then it includes the promotion of health, the prevention of a particular diseases, and the care of ill people, disabled and dying people. Then advocacy, promotion of a safe environment, research, participation in shaping health policy and in patient and health system management and education are also nursing roles. So, Advocacy means maintaining the rights of the patient, then promotion of safe environment, safe and clean environment for the patient, then doing research, contributing in the research part, and participation in shaping the health policies, better health policies that will be helpful each and every individual in the nation to get the better healthcare services. And in the patient and healthcare system management, also participate in the healthcare system management and providing education to all the nurses are also a key nursing roles. So this declaration is given by the International Council of Nurses in 2002. What are the core objectives of nursing? So mainly there are four core objectives of nursing. First one is to promote health, to prevent illnesses, to restore health, and to alleviate suffering. Let's go through it in the detail. So first one is to promote health. So what is promotion of health? So it includes the helping people live healthier lives by educating and encouraging them to make better life choices. So providing a better health education to the individuals, families, or communities, right? So they can live the quality of life. Let's give me some examples. So first example is organizing school health programs to teach children about hygiene and nutrition. So arranging a school health program, nursing are arranging the school health programs to teach children about what are the importance to maintain hygiene, right, in the school as well as at their home, and what are the benefits or advantages to take the good nutritious food. So second example is providing counseling on smoking cessation and alcohol avoidance. So nurses are also contributing in providing the counseling to the person who are smoker. So from providing the counseling on smoking cessation and alcohol avoidance. So nursing also providing the education that what are the disadvantages and what are the harmful effects of the taking the alcohol or smoking. Then third example is teaching adolescents about menstrual hygiene and reproductive health. So it also includes in the promotion of health, in a particular giving the education, then promoting balanced diet, habits to prevent lifestyle diseases like diabetes and hypertension. As I have already discussed that nurses are also contributing in the providing the education. If patients are suffering from a particular chronic diseases or illnesses from a long period of time, like a diabetes or hypertension, and they are taking medicines for that particular diseases. So nurses are providing health education to live the better quality of health lifestyle, and also what are the benefits of taking the balanced diet in the particular health condition. Then last example is guiding elderly people on safe physical activity and fall prevention. Then second objective is prevent illness. So it includes in taking proactive steps to avoid occurrence or spread of disease, education, immunization, and hygiene practices. Nurses are make sure that to avoid the occurrence or spread of infection. So nurses make sure they're providing the education, then providing the immunization, and providing the hygiene practices in the particular community. Then what are the examples of prevention of illness? First example is screening patients for early signs of illnesses like taking the blood pressure check, then monitoring their blood sugar level. So second example is teaching proper waste disposal and environmental cleanliness in slums or villages. So nurses also make sure that nurses are providing education about the what are the importance to maintain the clean environment, right? Particularly in the village and slum area. So it will not uh, occur or it will not spread the infection in particular community or village or slum area. Then third example is conducting TB awareness sessions in high risk community. So if so as we can see that the people have lack amount of knowledge if they are living in the villages or tribal areas, right? So nursing arranging the awareness campaigns to provide the awareness of tuberculosis in the high risk communities. Then fourth example is teaching food handlers and mothers about safe food preparation and storage. The next example is educating about safe sexual practices to prevent STDs and HIV. So nurse also providing the education about the some sexual practices, what are the safe sexual practices to prevent the sexually transmitted disease and also to prevent the infection of HIV. Then teaching cough etiquette and mask usage to reduce airborne infection. For example, we had a COVID in 2020. So what we were doing? So we were following some standard precautions, like whenever we go outside from our home, we make sure that we are wearing some mask, right? We are taking our sterilization uh, with us, right? Doing the hand hygiene in every 2 to 3 hours, right? So these are some precautions techniques prevent a particular illnesses. Then third one is to restore health, helping patients recover from illnesses, injury, or surgery, and guiding them back to optimal health and independence. So, if any person have gone through particular surgery, might be a cardiac surgery or lung transplantation, heart transplantation, or any surgery, right? So, people have gone through also surgery or injury, like road traffic accidents, and if patient have gone through a malaria, dengue, whatever, right? So nurses make sure that providing them the better care as well as the better education, right? So they can live the independent life and quality of life. So here are some examples. So monitoring vital signs and reporting abnormalities post surgery. So if a patient have gone through a CABG, so nurses make sure then in the ICU, right, nurses are monitoring their vital signs of the patient. Like it includes the blood pressure, then pulse, respiration, heart rate, right? And also if patient are on ventilator, monitoring the recordings of the ventilator also. Then reporting any abnormality after the post-surgery. If patient have any abnormality in the vital signs, so nurse make sure that report that particular abnormality to the doctor or to the senior staff after the post-surgery. So it is not only about the vital signs, right? Also ensure the whole patient health condition after post-surgery while they are admitting in the ICU. Then administering IV fluids, medications, and oxygen therapy for recovery. Then changing dressings and preventing wound infection. Then assisting in physiotherapy for stroke or fracture patients. Then educating family members about home care or medication schedules. Then if a patient have are discharged, right? So nurses make sure to providing the details of the medications, right? The time of medication, medication name, then medication dosage, right? Providing the education about the medication and what are the treatments are required at home. Then teaching a diabetic patient about insulin injection and diet. Then go to the let's go to the fourth number of core objective, which is to alleviate suffering. So it reducing the physical pain, emotional distress, and spiritual suffering, especially in the chronic illnesses, mental care, or trauma situation. It's about comfort, dignity, and compassion, right? Pa- If patients are suffering from any particular diseases or illnesses, right, where the patient are admitted in the hospitals. Patients are going through a lots of physical pain. Also, not only the physical pain, also they are suffering from the emotional distress, right? Then spiritual suffering. There are so many um situations that patients are going through while they are admitting in the hospital. So nurses make sure to provide the comfort, dignity, and compassion, and providing the kind behavior toward the patient. So basically, it includes the chronic illnesses. If patients are suffering from the chronic illnesses like diabetes, hypertension, and also providing the terminal care, and if the trauma situations. So it includes in the alleviate suffering. If patient are going through in a particular health condition or illnesses, to make sure to alleviate means to prevent suffering. Then let's go to the examples. So first example is administering pain relief medications and adjusting patient's position for comfort. So also the very first step is to providing a better position to the patients, right, for the comfortness, as well as to providing a pain relief medications as per the doctor's order, and providing a palliative care, cancer or terminally ill patients, then offering a listening ear and emotional comfort to anxious or depressed patients. So the very basic skill that nurse should have is listening skill, right? We should have an open ear and open mind to listen the patient situation, listen the patient's feeling and understand them that what they are going through, and creating a calm and peaceful environment in ICU or a spice setting. So, nurses make sure that providing the safe and clean environment as well as a peaceful environment in the intensive care unit, means ICU, or in the hospice settings. Patient will not get trouble. Then comforting a patient's family during code blue or after a patient's death. If um if code blue is activated in the hospital, so code blue is for cardiac arrest. So if patient having cardiac arrest, right, in the morning, evening, or night. Right. So nurses are uh, providing the empathy. Nurses are supporting the patient's family and also managing that situation of code blue. And if patient died after the cardiac arrest, also providing kindness and providing the support to the family members of the patient. Then, helping manage chronic symptoms like breathlessness or fatigue in heart failure, and teaching relaxation techniques like deep breathing or guided imagery. So, these are the core objectives of nursing. Then, there are other objectives of nursing as well. So, first one is collaborating with healthcare teams. Nursing are also collaborate and communicate with the doctors, the radiologists, then lab technician, medical officers, so many people who are working in a particular health organization. Then professional development. So professional development. It includes that you have a certain degree to providing a best and quality care to the patient, then providing education, providing consultation to the patient, attending the different conferences, workshops to upgrade your knowledge in the medical field. Then, utilizing the nursing process. Basically, nursing process includes five steps. So it's nursing assessment, nursing diagnosis, nursing planning, nursing after making the planning, you are implementing the action, nursing implementation, and then you are evaluating the health condition of patient. So utilizing the nursing process is also objective of nursing. So there are also so many objectives are there. So I have written some important one here. So what are the scope of nursing practices? What are the scopes of nursing practices? So here I make a acronym that you can easily remember, right? So there are so many scopes of nursing uh, now in today's world, but here I have written 10 or 12 scope of nursing, so you can easily remember. So just remember the acronym. So it's a nurse care. So what nurse is providing? Nurses is providing better care to the patient. So that's how you can remember the scope of nursing practices because it is the most important question that usually asked in the examination. So what N stands for? N stands for nursing education, providing a better education. U means universal health or community health nursing. Then R means research in nursing. S means surgical or clinical nursing. E means emergency or disaster nursing. Then C. C means critical care nursing. A means administrative nursing. R stands for rehabilitation nursing. E stands for elderly or geriatric nursing. Then S stands for school or pediatric nursing. So let's go in some details. So, nursing education. So, what is nursing education? So, nurses teach and train future nurses in the college or hospital. They help shape knowledge, skills, and confidence in becoming a professional. And what is universal health or community nursing? Community health nursing is usually nurses promote health and prevent disease in homes and villages. They educate people on maintaining the hygiene, taking good nutritious food, and maintain some healthy habits. Then, so what is research in nursing? So nurses conduct and use research to improve patient care, evidence-based practices to help in making smarter clinical decisions. The nurses are also participate in the research to improve the patient care. And also it's based on the evidence-based practices. It is based on some scientific principles that help in making smarter clinical decisions. Because nurses have also responsibility to take the decisions of the patient health care. Then, as for surgical or clinical nurses, and clinical nurses provide direct care to the patients in the hospital, right? Whether in the ward side or ICU or cath lab, right? Nurses are working with the patient. Then they give medications, assist in procedures, and monitor recovery. They are working in the ICU. Make sure they are monitoring the patient's vital signs by 24/7 and also maintaining all the records and reports of the patient's health condition and also communicate and collaborate with other healthcare team members, provide a better healthcare quality care to the patients. So also nurses are assisting in particular procedures and monitor the recovery of the patient. Then E means emergency or disaster nursing. Then These nurses act fast in trauma, accidents, and disasters. They are trained to save lives under the pressure and chaos. Then C means critical care nursing. The nurses here care for the sickest patients in ICU. They monitor life-saving machines and respond to sudden changes. Critical care nursing, nursing working in the ICU, intensive care unit. So patients are maybe at the end stage of life, or patient are on the ventilator, right? But not responding the very well to the treatment. So nursing have a skill to provide critical care to those such type of people, and also save the life through operating such medical equipment. Also, they have such knowledge to how to give CPR, or what are the steps of SCLS, BLS, right? They have such type of trainings to handle such type of critical patients in the ICU. Then I means rehabilitation nursing. Then it includes these nurses help patients regain strength and independence. They work with stroke, accident, or surgery patients on recovery goals. So if patient have accident or surgery like a few days back or few months back, and they are at the rehabilitation stage. So nurses are providing strength, providing the education to such type of patients to, to their better recovery. Then E means administrative nursing. So nurses are not just only providing the treatment to the patients, right? Nurses are also great in the administrative uh, management. So nurse administrators manage teams, policies, and schedules. They ensure smooth healthcare delivery and staff coordination. Then, he means elderly or geriatric nursing. Nurses support older adults with chronic illnesses and aging needs. They offer care with patience, respect, and compassion. So nurses have skills to how to handle such type of aging illnesses, age-related illnesses, and also providing patients, also communicate with the old age people, also build the trust, and providing the respect the old age or geriatric patients. Then as means school or pediatric nursing. Pediatric nurses care for children in the hospital or school. They ensure kids are healthy, safe, and emotionally supported. So kids or children are vulnerable age. So nurses make sure that providing education to the mother and father of the particular child about the what are the nutritious food that children should take, then how to handle such type of behaviors of the children, right, at home or in the school, and how to emotionally support to the kids or children. Then telehealth nursing provides care through virtual platforms using video calls or chat, helps monitor chronic conditions, give advice, and reduce hospitals visit. So, what are the benefits of telehealth nursing? So, there are lots of benefits of telehealth nursing because nurses can connect the patients to the mobile phone, right, to the computer, or to the PC. So, it's a very beneficial for both the healthcare worker and patient, because patient uh, no need to travel the hospital. So, it saves time, it saves money of the patient. So nurses are providing education and advice on the phone call, and also maintain the records of the particular call. So legal health nursing. So assist in medical legal cases by interpreting patient records and standards of care, works with lawyers, insurance companies, and courts. So nurses ensures that um, providing or maintaining the rights of the patient and also work with lawyers and some insurance companies and courts to maintain the rights of the patient and maintain the standards of the care in the hospital setting. So this is the bonus slide for all of you. You will definitely love it. So bonus slide includes difficult words made easy. So if you are in the first year of nursing, whether you are a GNM student or BSc student, right? So these medical terms are maybe difficult for you to understand. Maybe you understand the word, but you are not able to express it, right? In the speaking. So here I have written some important terms that we have learned in the particular part one of introduction to nursing. So I have chosen some medical terms and I have written terms and the simple meaning of the particular word or term. So the first term is health promotion, which means helping people stay healthy and live better lives. Second is illness prevention, which is stopping diseases before they start. Restoration, helping someone recover and return to normal after illnesses or surgery. Then alleviate, to reduce pain, discomfort, or suffering. As I have already discussed, that alleviate means prevention of reducing the pain or discomfort of the patient and patient suffering. And then clinical nursing is nursing care given inside hospitals or clinics and community health, taking care of people in their homes or local communities. So then next term is research, studying or discovering better ways to improve nursing care. Then administration, managing nursing work like planning, supervising, or decision making. And ICM or ANA. So we have learned the definition of ICN, means International Council of Nursing. And so it is international or national organizations that guide nursing standards. Then empathy, truly understanding and feeling what the patient is going through. Autonomous, acting independently with responsibility, using your nursing knowledge. And collaborative care, working together with doctors, therapists, and others for best patient care. And other words are EBP, means evidence-based practices, using best research and experience to guide patient care decisions. And compassion, showing kindness and deep care for others' pain and struggles. Educator, teaching patients, students, or new nurses with patience and clarity. And advocacy, standing up for patients' right choices and dignity. Then holistic care, caring for the whole person, body, mind, spirit, not just the illness. Then professionalism, thing with honesty, responsibility, and respect in all nursing roles. Then, so now it's your turn. Can you answer this? First one is, what is the meaning of the letter R in the word nurse? Can you answer this question? Second one is, give the definition of nursing by ICN. Then name the four core objectives of nursing. Then name any five scope of nursing. Then what is the meaning of the word empathy? Then last one is, what do you mean by evidence-based practice? Means EVP. So here I have written some questions, right? And I will look forward that you will write down the answers of that particular questions in the comment box. And I will definitely love to hear the answers of you. Then, so coming up in the part two, So this is particular part one of the introduction to nursing. So what coming in the part two? Let's go deeper. So next we will explore the real work nurses do every day. Like in the part two of the series of introduction to nursing, it's we will cover the functions of nursing, the roles of nurses, the responsibilities in daily practices. What are the responsibilities of nurses while they are working in the hospital, or whether they are working in the healthcare sector or community health center or the in the education field. And if you want to know what makes a good nurse, so that's coming in the part two. The qualities and professional identity of a nurse. I would like to thank you to each and every one of you to stay till the end. And you are already a champion. Let's keep learning, growing, and leading together. If you found this video helpful, subscribe to my YouTube channel, The Next Gen Nursing, and turn on the bell icon so you will never miss any further lessons from my side. So share this video with your fellow nursing students or with your friends so they will also learn. If you have any questions or topic in mind, comment down in the comment section. I would love to hear from you. Your question might be featured in the next videos. I will I will be happy to hear from your side. So if you want PDF of this particular video, that whatever the topics have covered in this particular video, so the PDF of the content of this video is available on my FB page. It's the Next Gen Nursing. So I will give the link of my FB page in the comment section. So you can download the PDF as well. So I would like to thank you to each and every one of you once again.